Thank you for joining our webinar today. Get the right information at the right time. Who is Highbridge? Highbridge Solutions is Georgia's Health IT Center for assisting clinicians in the redesign of healthcare delivery through the successful adoption of health information technology and interoperability systems. We're located at Morehouse School of Medicine, the National Center for Primary Care. Our presenters today is Carmen Hughes, which is the Health IT Division Director here at Highbridge Solutions, and Cameron Fletcher, the Director of Technical Assistance with Highbridge HIE. Today's webinar objectives are: review the use of health information exchange, understand the benefits of utilizing HIE to exchange data, share a demonstration of the HIE platform. I'm going to turn it over to Carmen Hughes to elaborate on the following objectives.
Thank you, Selena, and good morning, everyone. I guess it's afternoon now. It's afternoon after 12 o'clock, so good afternoon, and I am thrilled to join Cameron and Selena in sharing information on the importance of interoperability through health information exchange with you guys today. So specifically, who is Highbridge HIE? We are one of the 4 regional HIEs, Health Information Exchange, connected to the state designated Health Information Network, or GHIN, as we like to refer to it. And the HIE was founded, our HIE was founded in 2014 as an offshoot to our regional extension program, with the goal of creating an interoperable solution, as Selena mentioned, for eligible professionals, or EPs, participating in what was formerly stage 3 of meaningful use. But most importantly, our goal and our mission is, as the title of the slide, the title of the presentation is, get the right information for the right patient at the right time. We have grown and morphed significantly over the past few years, in particular the last year or so. However, our focus really continues to be those small and independent practices, hospitals and organizations serving in rural and underserved communities. We know that those communities are often left behind by the technology growth. So we really want to focus our efforts in those particular areas. A bit different from the other regional exchanges in the state is Highbridge is not sponsored or operated by any hospital, clinical system, an EHR, or we're not limited to a clinical specialty or a geographical area. We like to say that we nicely fill in the gaps for the many clinical practices and organizations that are vitally important in a patient's continuum of care. We are also not bound by electronic health platform. We work with disparate systems across the platform and offer opportunities for clinical care document view for those who may not have a certified EHR system. So again, I just want to emphasize that the primary benefit to connecting to an HIE, and I'm going to say it repeatedly, is getting the right information for the right patient at the right time, with the goal of improving healthcare quality and outcomes, avoiding costly mistakes, reducing health-related costs, eliminating barriers, increasing patient care coordination, and also increasing equity in patient care. Some of those are ONC's guidelines and goals, and then some of my own personal that I've added to that list. But these includes reducing and hopefully avoiding duplicative tests and treatments, the ability to reconcile patients' medication history and often prescription adherence increasing, leading to fewer medication errors. It allows for public health reporting, including vaccination and labs, and testing, which is really important, particularly in the COVID pandemic. Increases overall efficiency of care delivery by streamlining the patient's records into one source. Again, eliminating unnecessary paperwork, emails, of course, secure emails, phone calls, and actually I talked to a provider the other day who was exchanging emails in not a secure environment. So we want to make sure that we address those areas. And of course, maximizing staff time, but all in search of seeking a full clinical view for your patients. In some cases, with the right integration with your EHR, the HIE will enable queries for the next day scheduling of your patients. And Cameron will talk more about the integration availability in the next section. I also want to note that Highbridge has partnered with national agencies and organizations that are on the cutting edge of technology, and they're focused on serving the greater community. They share our mission of eliminating the prevalence of health disparities and increasing health equity. So next slide, Selena. When I think about the big picture, particularly around interoperability, I feel like I need to provide a little context and a little history. So going back about 10 years ago, we know that the HITECH Act really helped to boost supporting new health technology and the development of the workflow process. Moving into not just adoption and use of electronic health record EHR technology, but also more advanced forms such as telehealth and health information exchange and other digital health technologies. In the beginning, the EHR technology allowed clinicians to begin to gather the information in a more advanced method, but then it's moved on to, of course, in the, I'd say 2013, 14, as meaningful use began to really dive into the different stages of, at the time, meaningful use, there was a direct impact to incentive payments and reimbursements. And so we saw more widespread utilization in EHRs, particularly in primary care settings. But now, digital health technology is a term that's widespread. It's growing at an even more rapid pace, particularly over the 18 months, responding to the technology demands stemming from the pandemic. We know that consumers and healthcare providers equally really are embracing technology in more advanced forms in everyday decisions, from fitness trackers to mobile applications, tracking insulin administration. Digital tools can provide consumers as well as providers, but particularly consumers, with a wealth of valuable health information. And that's something where we've seen consumers take more control of their health and their health diagnosis, but also care. Studies demonstrate really that consumers are better informed to make better health decisions, more efficient decisions using technology. And this helps in the steps to their own healthy lifestyles, their health choices, and really better outcomes. So just to kind of tie this to bigger picture together and having the data flow through the HIE network, I want to reiterate really that providers are using the digital health in efforts to reduce efficiencies, reduce cost, increase efficiencies, improve access, better care coordination, quality of care, and they, of course, make medication more personalized for patients. And patients themselves through the network are able to use digital health to better manage and track their own wellness benefits. And so circling back to that big picture where you see this care continuum, you have the regional HIEs. I've also included the GHIN logo at the top because GHIN is, again, our state designated HIE, helping that flow of interoperability to be more cohesive and consistent. But when we look at the big picture, every facet of the healthcare industry is really involved in digital health and interoperability. And that's from the payers to the providers, manufacturers, correctional facilities. We'll talk a little bit about, I think I mentioned payers, and other state agencies. But really this has turned into, the last I saw was approximately a $7 billion business around interoperability. So we play a key part of that, particularly in Georgia and the region. So keeping on thinking about the bigger picture, it's important to share the role it plays, interoperability plays in the CMS programs and value-based care. So for those of you all that participated in the Medicaid EHR incentive program that just ended, and for those who are still part of the Medicare Quality Payment Program, there are 3 objectives that are focused on promoting interoperability. I just want to highlight very quickly because it's really important. Of course, these are CMS programs. The first objective is for health information exchange is supporting the electronic referral loops by sending health information. So whenever a patient moves from one care setting to another, such as a hospital, primary care, home care, specialty care, et cetera, the sending clinician is required to create one summary of care record using the certified technology, EHR technology, and exchange that summary of care record electronically. So if Aunt Mary's primary care refers her to her cardiologist, and an electronic summary that at a minimum includes her problem list and an active current medication allergy and any known allergies. So that's number one objective. Number four, related to health information exchange, is supporting electronic referral loops by receiving and reconciling health information. So for new patient encounter within the performance period, the clinician conducts a clinical information reconciliation for medication, medication allergy, and the current problem list. So going back to Aunt Mary's example. So when Aunt Mary gets to the cardiologist, the clinician receiving her referral has a new patient review her summary of care and ensure her information is recorded in her electronic medical record. And for the third one related to HIE, the health information exchange and bidirectional. For bidirectional exchange, the MIPS eligible clinician or group participates in an HIE to enable exchange of electronic health information for every patient encounter, transition, or referral, because I want to read it just as it's listed, and records stored or maintained in the EHR during the performance period. The EHR that they participate in has to be capable of exchanging, and that's a whole different conversation, but it should be a certified technology, but exchanging information across a broad network of unaffiliated exchange partners, including those with the disparate EHRs, and does not engage in exclusionary behavior when determining exchange partners. Gotta love CMS wording. So the clinician would use the functions of the certified EHR technology to support the bidirectional exchange of the EHR. So Aunt Mary's information will travel between places, and that's the goal of service using the HIE as an information bridge. So if you're participating in the MIPS program and you need some more clarification, because I know I went through that very quickly, please reach out to us. As you all know, a big part of what we do is servicing members and providing technical education and training around the CMS programs and objectives to maximize your reimbursement with Medicaid on the incentive side. So our resident experts are in this area would be Phoebe Nelms and Liz Hampton, both are on the call. But if you have some questions after, feel free to reach out to us. So narrowing down to hybrid HIE, in this infographic, we've attempted to visualize the flow of data through hybrid HIE that I've been referencing in the previous slides. We use a cloud-based platform engine through the NextGen Health Data Hub, which again, Cameron, I'm excited, will create a demo for you to see the platform. But within the HIE, we have data exchange connections with independent ambulatory practices, small and rural hospitals throughout the state and beyond, as well as with other entities of patient care delivery. These patient records are made available to all who are connected to Highbridge HIE, as well as all GHIN members and their connections. However, sometimes we find the entities in certain communities have a need only to share data in their specific communication or their specific communities to better enhance the care coordination within that particular population. So then we would establish what we call a community health network or a clinically integrated network. And you see that on the left. This could be the primary care provider along with referring specialists, long-term care, local hospital, or maybe in-home care facilities, a treatment that's part of the care coordination. We're also excited to have brought on board correctional care facilities in the state to help in medication reconciliation and care coordination within this specialized group of population. We partner with connections with ambulatory primary care practices, I mentioned, specialty care, value-based organizations within Georgia and the region. And we're working to connect several emergency management agencies and services to make patient data available to them at the scene or at the point of care. The HIE will generate aggregate patient records through medication history through our partnership with Dr. First, lab and radiology and electronic orders, results, etc. Through GHIN and as a regional HIE, we're also able to exchange, as I mentioned, most of the large healthcare systems in the area or in the state, care management organizations, state agencies such as the Department of Behavioral Health, Department of Juvenile Justice, Public Health, as well as large specialty clinics, and the National eHealth Exchange and other health information networks across the country, to name a few. And last count that I saw from GHIN, I think that really represents about 25 million unique patient records exchanging through GHIN. And again, as we are regional HIE, all that data flows through us as well. But the key, as you all know, to any HIE is making sure you have the data that you need. Again, getting the data for the right patient. So we'll work with you if you find that your connections that you might need, and Selena, if you don't mind flipping to the next, if your connections that you need to have patients through your care coordinations are not listed, we will work with that particular organization and with GHIN to try to get the connection going. So this is really just a visual of the connections that I just mentioned. So this is not an all-inclusive list by any means, but it does show some of the state agencies, the regional HIEs, the four that I referenced, the care management organizations. But the list continues to grow. However, again, if you don't find your particular one, then we will work with the team to figure out how to best get the data that you need for the patients that you serve. And I am now, I believe, going to turn it over to Cameron.
Yeah, hi. Yeah, so thank you, Carmen. We at Highbridge, the platform, we are able to offer quite a wide variety of ways to interact with the data that we have available. So Carmen kind of just covered, all of the ways that we have access to data and where it comes from. But really, the magic is what we do with that data once we receive it and how we present it to you and make it actionable for you and your providers. So the most critical component of our platform is the way that we aggregate patient information across multiple data sources, be that different practices or different facilities or hospitals or labs. We take all of this information that comes from, maybe unconnected sources, and what we're able to do is provide what's called a longitudinal view of the patient's clinical history. And included on that is pretty much every piece of clinical information that you would expect to see in the patient's chart in your EHR. So problems, medications, allergies, directives, anything that, you would see in your patient's chart is information that we can aggregate and build kind of a patient summary for. I'll get to it a little later, but there are different ways that we then present that information back to you, whether, we aggregate this record, this patient's record, and send it directly to your EHR so that you can see that information where you're actually treating the patient and where your team is used to it. But we also offer a service to view clinical data through our Health Data Hub portal. So that's really at the heart of what we do is aggregate patient data and deliver it to you in a way that's actionable for your team. Carmen kind of hit upon our connection to the Georgia Health Information Network. That's just one of the many ways that we are able to source information on patients from systems like hospital systems or larger regional networks. And we take that information and that's what gets fed into the system that's responsible for aggregating that data into a singular summary. And in addition to the Georgia Health Information Network, we have medication history provided through Dr. First and SureScripts that allows us to pull at a national level medication history for patients. So super valuable. We see that that's super valuable information, especially in the work that we've been doing with correctional facilities and populations that don't necessarily come to the facilities with a brown paper bag full of their medications. This is super important information that providers need access to, that we're able to offer through our platform. Next slide. Clinical content management. So I kind of talked a little bit about this when talking about the patient summary, but we support and can aggregate and filter and search and do all of our fancy data aggregation on any type of clinical items, be that lab results or problems, medications, allergies, or conditions or procedures, you name it. If it's in your EHR, it'll be visible on the patient's record when we send it to you, or if you view it in the portal. We offer, Carmen mentioned, a really robust and cutting edge way of managing patients internally through our master patient index. So, we intelligently can match patients based on a host of demographics that we receive. So, you don't necessarily have to be concerned that if you're treating a John Smith, that you might be receiving the wrong record. We put a lot of thought and care into making sure that, do the birthdays match? Do they have the same social security number? Are their addresses the same? Information like that all gets considered when assessing, finding, again, that right patient and their right clinical information delivered to you. This is one of the ways that we deliver on that. In addition to that, consent and data protection. So as Carmen mentioned, our Health Data Hub platform operates in the cloud, but it is all encrypted end to end, and it's industry standard encryption and security that we offer, along with the ability for patients to control who has access to view their records within the network. So patients have the ability to decide whether or not their information is shared at all within the network, or under what circumstances it is, if I as a patient want my record to only be shared in emergency treatment situations, I can make that decision, and we will respect that and make sure that data is only granted if that condition is met. In addition to that, access to meaningful insights, because we offer kind of an aggregate view of clinical information within the network. We have the ability to provide population health statistics and metrics at a kind of higher level view beyond just the point of care. We're able to take a look at general health trends within the networks or the populations that we serve, and be able to deliver that to you in a meaningful way. So here we go. So it's important to note when connecting to an HIE that it's kind of like a snowflake. No two are the same. We follow very similar practices and different setups, but it's important to note that we have flexibility in terms of how we get you access to this data and how we get access to your data. So if your EHR is capable of doing or incapable of connecting a particular way, we very much work with you and your EHR vendor to try and figure out what the best path forward is. Getting you the most information that we can deliver, kind of given those limitations. So we've kind of classified 4 levels of connection, and again, these are kind of loose. We can kind of mix and match depending on your particular case. But just broadly, level 1 is portal viewer access. So access to our online web-based clinical viewer, where you can look up patients within the network, look up their history, and see any available information that has been provided or retrieved at any previous point in the care continuum. Level 2 is a bidirectional data connection. So bidirectional meaning that not only do we receive clinical information from you at the point of care, but you also receive it from us. So bidirectional meaning, data flowing both directions, from us to your EHR and from your EHR to us. Then there's EHR level querying. So being able to, we've seen in some EHRs, maybe this is filling out a form, maybe this is opening up the patient's chart and clicking a button, to retrieve documents from the HIE, but really just ingraining it in the workflow a little tighter, that allows you to have quick and easy access to retrieving information that you and your staff can utilize at the point of care. And then level 4 is kind of the holy grail here, where we have full automation with scheduled querying, and everything kind of just runs in the background. So we pull in your schedule information for the next day, and we intelligently know how to query for those patients. We get the records all ready for you, and we push them to your EHR ahead of time. That way you're not spending time at the point of care waiting for documents to be downloaded from the network. And that's where we would like to see all of our providers go. But again, it depends on what your EHR is capable of, and what kind of information, how you're looking to build this into your workflow at a practice level. So here's just a high level kind of diagram showing what an EHR integration looks like, and how Highbridge fits in. So it all starts with you and your providers in your EHR, you interacting with your chart. We want to make it as easy as possible to just fit this into your existing workflows without needing to retrain your staff, without needing to do any sort of heavy lifting in that regard. And so that's why an EHR integration really is ideal, because it's a familiar environment for your staff, and it allows them the easiest and most seamless way to get access to this data when they need it. And so you can see here within the kind of EHR bubble, there's an HIE integration specifically to Highbridge. And that allows the exchange of CCDA documents, or those patient summaries that I was talking about earlier. And then from there, you can kind of see the different data repositories that we have access to, be it through GHEN or Dr. First for medication history, or our other HIE members. So other facilities that are connected to us are also contributing their information. And so that means that you have access to the GHEN community network, larger state facilities like Carmen mentioned, national pharmacies, as well as rural and underserved communities through our efforts with direct connections to other HIE members. So as you can see, there's a lot of potential for data to flow on a patient. We cast a pretty wide net and try and see, and get everything that's available for you to give you the most complete picture of the patient when they're at the point of care. So here's kind of just a quick screenshot of what our portal kind of looks like on a patient level. And again, kind of talking about the consent, I had mentioned it in a previous slide, but this is kind of where, at a portal level, you're able to see a patient's data if they allow you to in certain situations. So you're kind of saying why you need access to the confidential data. But yeah, we'll get more into the inner workings of the portal, but this is just a quick glimpse. So integration timeline, we've seen this kind of vary a bit, and it really depends on your EHR vendor and what their capabilities are at a technical level. And so we always start off integrations with a project kickoff, where both sides kind of, all three parties kind of come together, Highbridge, yourself, and your EHR vendor. We come together and figure out, what is the path forward to connection, and then that kind of sets the stage for the rest of the integration, right? After the project kickoff, and kind of in parallel, happens provider onboarding and technical scoping. So we typically approach an EHR integration kind of in phases, where we will initially bring your providers onto the HDH, or the Health Data Hub platform, first, so that they can get access to this data immediately. And then in the following weeks to months, we will be working with your EHR vendor to kind of set up the technical connections to allow you to query directly in your EHR without having to use the portal. And so depending on vendor availability and technical limitations, we've seen integrations take anywhere from around 3 to 6 weeks to complete. And then obviously we go through different testing phases, and then support and maintenance. So, if you ever have any questions, we're always available afterwards. Next slide. So here we're gonna get into the portal, a couple key screens and important features of the portal. Starting off pretty simple is the login screen, pretty straightforward, but important to note that we can create accounts for all of your providers. So they would have their own individual accounts. They would have their own access to the portal. We can fine tune what providers have access to, what they don't have access to. In some cases, who they have access to. If they only treat a specific subset of patients, then we can limit what they have access to. But yes, your entire staff would be able to utilize this portal and get access to the data that they need. And that's something that we offer. So once you log in, here's kind of the landing page or the dashboard. Again, pretty straightforward. This is where you're typing in your patient demographics for your whatever patient you're trying to treat. So last name, first name, date of birth are 3 of the fields you can type in. In addition to that, you could also use the MRN for the patient that your EHR uses. If you need a direct match to a patient, you don't want to scroll through a list of potential matches. But we also offer the ability to do advanced searching. So you can search for patients based on conditions. You can search for patients based on medications they may be taking. You can search based on a whole host of things. And I know that in the past few months, a more pertinent use of this has been for COVID, being able to identify patients who are immunized against COVID-19. So that's one of the more powerful searches that you can make. But at a basic level, typing in first name, last name should get you pretty close to the patient you're looking for. Here we go. So this is what you'll see when you do search for a patient. You'll kind of see a table list of all of the patients that match the parameters that you typed in. So be it first name, last name, or you can just leave them all blank and see all of the patients who are registered within the network. And here you kind of get a high level summary of the patients, primarily their demographics right here. And so you can see first name, gender, date of birth. You can do sorting based on all of that. And then up in the top corner, you'll see a little box with a drop down that says patients. One of the things that the platform allows is kind of changing what this summary is going to be showing you about a patient. So if you want to look at medications or you want to look at immunizations or allergies, you can kind of change what criteria shows up in this search table, which has been helpful. Okay, so once you've identified the patient that you're trying to treat or trying to get information for, you click on their name, obviously, and then you kind of jump into their summary. So this is kind of what I was talking about by the longitudinal record of the patient's history. So here's where we'll display any encounters that they've had in the past, any allergies that are recorded, lab results, medications, prescriptions, immunizations. And it's important to note that you're not just looking at one encounter here. This is the aggregate history of all information we've received on a patient from the first time, from the point they were registered and had their first encounter sent to us all the way to present. So this is really offering you the bird's eye view into the patient's history across different facilities, and different points of care. Which can be very beneficial. And each card has its own kind of breakdown and summary of each clinical item. So allergies is going to have, what the allergen is, the reaction. You've got lab results. You can see the name of the lab, the date it was done, and where it came from, as well as, there's subheadings there for imaging and whatnot. Medications show you the name of the medication, the dose and the strength, prescriptions, name, strength, dosage. So really just trying to give you as much information as possible on each patient that we have available to us. So we recognize that, a summary view is nice at a high level, but if you're treating a patient and they've got an allergy to wheat and that's important at the point of care, you're going to want to know more information about that. And so we have a kind of more detailed view of each clinical item that you can click on that will open up and tell you a lot more information about each specific clinical item. So it'll tell you when we received this information or when it was first noted in the patient's record, the type of allergy, any reactions they may have, And then listed off in that left-hand sidebar is all of the other listed allergies on the patient's record that you can then click on and view the expanded view for as well. So, okay, here is an example of a lab result that was taken. And here's where you can really, this is a lot of information. But if this is pertinent at the point of care, it's good to know that it's here. You can see when the lab was taken, the order ID, the filler ID, what provider was responsible for either ordering the lab or authorizing it, as well as the results for the lab, and all of the different fields and interpretations that are associated with that. So super, super important. And again, as with all of the different clinical item types, when you're viewing an expanded view of them, all of the others show up in a kind of timeline on the left-hand sidebar that goes from most recent to oldest reported clinical item. So here's external documents. So on the patient's record, we have the ability to, this is where our connection to Dr. First medication history and the Georgia Health Information Network comes in. You can at any point, kind of on demand, request for more documents from GHEN or Dr. First medication history. So, what we typically see providers do is they'll request for external documents right before the patient presents or comes in for treatment. And basically what that's doing is ensuring that, you've got the most up-to-date information from within the network available to you to review. And on this screen, you can see all of the documents that came in from GHEN, AmeriGroup and Healthy Connection and Emory and, all of the different GHEN participants that Carmen had kind of listed on that slide. Basically when you request external documents, we're going to go ask each and every single one of them, hey, do you have clinical information for this patient? And if they do, they'll send it back to us and then you can then view it on the patient's record. So this is kind of where our GHEN and Dr. First connections come in handy. And it's important to note here that when we're talking about an EHR level integration, these kind of all happen automatically behind the scenes. So when you query for a patient in your EHR, we're automatically going out to ask GHEN and Dr. First, hey, do you have any information on this patient? As well as asking our own connected members, is there any available information within our own network that we've previously seen? So just thought I'd throw that in there. Are there any questions about anything that I covered in terms of an EHR integration or the portal capabilities or even just our core products and services that we offer? I'd be happy to help answer some of those.
If anyone has any questions, you can drop them in the Q&A. Just want to thank Carmen and Cameron for this valuable information today. As they both mentioned, our HIE services, we do provide costs here at Hybrid Solutions to offset some of the costs for implementation. So if you are interested, Carmen's contact information is at the end of this presentation. Okay, this slide is just a few resources. The presentation will be available on our website. If you have any questions or need anything before it is available on our website, just please reach out to myself or Carmen and we can send this resource page or even send the presentation to you. I also want to share with you, we partner with ForMed Approve. So if you have any practice managers, any providers or any coders or anyone that's interested in our continued education, we provide a 20% discount. Reach out to us as well and we can get you connected with that. So there's some really good courses out there for your practices for continuing education. And I think some of them do provide certifications if you have to get certifications for some of the certificates you have. So if you have any questions, just reach out to us. And thank you all for joining today.